You can see the intervertebral disc, and if you are to look at which is a fibrocartilage, if you are to look at the structure, in the middle of it, we have the nucleus pulposus, and then on the periphery, we have the annulus fibrosus. So those are the divisions that you will have in an intervertebral disc if you are to cut through it and look at it. So more on intervertebral disc, some details. So as I've already said, it's responsible for around 1/4 of the length of the vertebral column. That is a quarter of the entire length of the vertebral column will be formed by the intervertebral disc. If you are to add all their lengths, then you'll get 1/4 of the entire length. And generally, the intervertebral discs tend to be thickest in the cervical and lumbar regions, where movement is greatest. Just generally in your spine, most of the movement will be at the neck and at the lumbar region. Yeah, generally, if you see most movement, it will be there. So at that point, at the neck, cervical region, and the lumbar region, the intervertebral discs will be thickest in those areas. So they'll be thin in the thoracic region and probably the sacral region and the others. Yeah, lumbar region and the thoracic region. So they are regarded, these intervertebral discs are regarded as semi-elastic discs, which lie between the rigid bodies of adjacent vertebrae. So the vertebrae themselves are bones, so they are rigid, but these intervertebral discs, as I had said, they are a semi-elastic disc. That is what makes the spine or the thoracic, the column, the vertebral column, be more flexible as a whole. Working as a unit is flexible rather than it being rigid. So it serves as a shock absorber when the load on the vertebral column is suddenly increased, e.g. from jumping from a height. So if you jump from a height, these intervertebral discs act as shock absorbers. So it helps you to be able to land smoothly and prevent injury. Yeah, one thing to note there, however, is that the resilience of intervertebral discs are gradually lost with advancing age. So as you advance in age, that resilience tends to be lost. So they're not as compliant as when you are young, as you grow older. As I've already said, the peripheral part of intervertebral disc is what we consider as annulus fibrosus. The central part is called nucleus pulposus. And in a child, usually it's almost jelly-like, it's almost like a gel, the nucleus pulposus. So annulus fibrosus is fibrocartilage with collagen fibers arranged in concentric layers or sheets. So concentric is round, or it can be in sheets. So if you look at the nucleus pulposus in children and adolescents, it's ovoid in shape. It's a mass of gelatinous material containing large amount of water and a small number of collagen fibers and a few cartilage cells. So there is no disc sound between the first two cervical vertebrae or in the sacrum or coccyx. So in the sacrum or coccyx, there are no intervertebral discs. So intervertebral disc will be in the first two, that is the atlas and axis. Between the two, there is no intervertebral disc. But between the second and the third and so on, there will be intervertebral disc in the cervical region. Then in the thoracic region, there are intervertebral disc also in the lumbar region. But in the sacrum and coccyx also, the intervertebral disc are absent. In old age, the discs are thin and less elastic. So we already said, generally in old age, they tend to be thin and they are less elastic.